Good day everyone. Welcome to the CSA Medical Aesthetics. Dr. Contessa here, your certified aesthetic physician. In today's episode, we'll be doing a procedure called fox eye thread lifting. We need to do assessment before any procedure, and then on the forehead region, okay? So we have the so-called frontal eminence here, or the something that is projected, but below that, there's a beginning volume loss already. It's starting to become sunken, okay? Yan, Erica is laughing already because she's hearing a volume loss already here, okay? So this is the frontal prominence here, and below that prominence, you're having this sunken part here already, which is expected as time passes by. So some of our collagen, elastin, and tissues are beginning to atrophy. And on the eyebrow section, if you're gonna look at it, ideally for females, we wanted this arch there with a certain angle, okay? For some individuals, they want it around 15 degrees angle, or for men, like they want straighter or a little bit of an angle of like a 12 degrees or below that. Now for Erica, we wanted to improve the forehead section, so the center, and then the arch area and the tail of the brow. For the fox eye thread lifting, actually, the target is on the tail of the brow, or the corner of the eye. But Erica wanted a more natural look, and of course, not making her eyes look like Chinita or Korean. It's not like this, but it's more of lifting the brow and upper eyelid. So it's more of opening her eyes, not making it smaller or, yeah, that something like this. So we wanted to do a lifting, so it's gonna be more of a vertical lift. And for the kind of material that we will use today, we will have our spiral cog PDO threads to do our lifting. So we'll show that when CSA Medical Aesthetics return. And we're back. So we're doing the so-called fox eye thread lifting for Ma'am Erica. So we'll start working on the right side, and we'll be doing a so-called marking on this part of the forehead and also on the right temple side. So for the markings, we start with the entry point here at the hairline region and make this point here, and we can make a fanning technique towards this arch of the eyebrow. And for my reverse procedure, where my entry point will be here, 3 entry points there, and it's gonna be semi-vertical vector approach, okay? So for my product, I will be using the spiral cog and cog 60 millimeter length, okay? And we'll clean the area again. And of course, before doing your thread lifting, you have to anesthetize the region. Okay. So for the entry point, I can inject my lidocaine, a minimal amount. So my entry point is here. And then we'll make our puncture using our gauge 19 needle. There you go. And then I'll just glide a 60 millimeter length of our spiral cog. Cog threads are different from those mono plain type of PDO threads. When you say cog, so in that strength, or rather the length of the thread has some of those barbs, or something like a cog looking type of strands of threads. Okay, so we'll glide it towards this center of the brow region, and you can actually anesthetize further the area by injecting your lidocaine. Okay, some discomfort on the upper area there, on the brow area. Okay, we have to reach for that orbital retaining ligament, and I just need to glide further. And once you reach that end point there, then you can pull out. Then you can proceed to your second type of spiral, then going to towards the tail. So the goal is to improve the arch of the eyebrow, and then anatomical plane. You can notice that I am on a deep anatomical layer. because we're using thick threads, thick cog threads as much as possible. We don't want it visible on the surface. So we prevent those irregularities on the skin surface and going towards the tail of the eyebrow. So again, the goal is to lift this lateral portion of the eyebrow, creating that fox eye lift effect and pulling out. So the remaining strands you can cut out. There you go. And I can proceed to the corner of the eye, the lateral aspect towards the temple. So entry point, lidocaine. So we can make 3 entry points here. And then just puncture with your gauge 18 or gauge 19 needle. And my approach will be a semi-vertical vector. So I'm using spiral cog, 60 millimeter. Again, this is different from those plain monothreads. This one, it's cog, and cogs can have a strong bite in the tissues, and they can have a lifting, instant lifting effect. So just glide towards the scalp region and then pull out. Second, and glide towards the scalp again. So the section that we're doing is the temple area and some resistance there. Okay, press on that one. So we'll have to go towards the scalp region. And then I'm done with the second. Let's proceed to the third one. Last one. So sponge, please. Yeah. And this is the third and final spiral cog for this right side. So glide it towards that space and we pull it out and we cut the remaining threads. So it's a reverse technique of the fox thread lifting. Pull out, cut it out. Okay, press. So we have done the right side. Let's proceed to the opposite side, the left area. So we have done the brow thread lifting for Erica. We'll show the result when CSA Medical Aesthetics return. And we're back. So we have done the so-called brow thread lifting or fox eye thread lifting for Erica. And we'll show the result to Erica. And so she could appreciate the result of what we have done. This is a non-surgical, minimally invasive type of upper third of the face rejuvenation. The purpose is to somehow lift the brow area as well as the upper eyelid and kind of increase also like the size of the eyes or open up the eyes, something like that. So it's not the type of really making you chinita like, but it's more of restoring the eyebrow position and the upper eyelid into that higher part of the upper third of the face, and somehow preventing already the aging signs and also restoring volume and at the same time stimulating collagen formation. So these kinds of BDO threads are clinically proven safe. So they are absorbable, but they have an effect of collagen stimulation and elastin stimulation. So they help in restoring the firmness and tightness of the skin. They also help in preventing wrinkles or lines. So if you compare it with the Botox, so the Botox is targeting the muscles so that you don't have that wrinkle or line. But the Botox is more of inhibiting facial expressions or the expression muscles. For those individuals who are not into having Botox injections, this will be an alternative type of treatment. So as time passes by, you'll still see more improvement because the PDO threads can stimulate collagen and elastin formation in a period of 12 weeks time. So again, these are absorbable. Since we use the COG type of threads, they dissolve or they are hydrolyzed in 12 months time, but the effect of tightening and firming is longer lasting. If you have any questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, and our Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. So thank you. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.